Hi, everybody. Thank you so much for joining us today. I'm going to say good morning, good afternoon, and good evening, depending on where you are in the world. I know we have people from all over. My name is Nick Zarowski, and I'm a senior manager for policy and advocacy at the Alliance for Peacebuilding. And I am so happy to welcome you all to the second event as part of the SDG16 Plus Storytelling Initiative. And just for reference, this is a joint effort by the Alliance for Peacebuilding, the Civil Society Platform for Peacebuilding and Statebuilding, Forus International, and the Transparency, Accountability, and Participation Network. So just a bit about this initiative. What we're trying to do here is strengthen local civil society's capacity for storytelling as a tool to advance peace building and justice and the implementation of SDG 16 plus. We're also trying to build connections across the SDG 16 landscape, share lessons learned and best practices, and harmonize and amplify stories of civil society, elevating SDG 16 plus at the national and local levels. Just a bit of background, we had our launch webinar in January, and you can read a recap of the key takeaways of that event in the link I will drop in the chat in a few seconds. But at this launch event, we talked about how storytelling inspires change in SDG implementation. We talked about the ethical considerations of storytelling, and we talked about the challenges and innovations involved in successful storytelling. So today, for the second event, we're going to discuss the interlinkages of SDG 16 across the entire Sustainable Development Agenda. And we're going to think about how we can build joint narratives that build strong, integrated, and coordinated messages to support peace, justice, and inclusive institutions, looking to sectors like gender equality and health and others. Just one housekeeping item, you do have the option to select closed caption interpretation. They're automated, so they're not 100% accurate, but they are a form of interpretation that you can use. So with that, I'm going to turn to my colleague, Dr. Jayatsna Mohan Singh of Forus International to introduce our wonderful panelists today. So thank you.
Thank you so much, Nick. Good evening, everyone, and a very warm welcome to our panel discussion. I'm Jyotsna Mohan Singh from Forus International, and I'm truly delighted to be moderating this important exchange on the power of storytelling in advancing SDG 16 and its vital connections across the broader 2030 agenda. We are joined by three outstanding speakers who bring grounded real world experiences from very different contexts, but who all use storytelling as a critical tool to build justice, peace, and inclusive societies. Each speaker will have about 6 minutes for their main remarks, followed by 2 minutes for concluding or follow up questions. After we hear from all three panelists, my colleague Elise will lead a question answer session. So please do post your questions in the chat throughout. Now, let me briefly introduce our speakers. Dr. Moses Izuba, who is the Executive Director of the Uganda National NGO Forum, leads advocacy and coordination efforts across civil society in Uganda and globe, and a focus on civic space, governance, and development functioning. We have Leonie Mitoni from the Legal Aid Forum in Rwanda, who works as the intersection of legal empowerment and gender justice and was recognized as a finalist in the 2020 Voice of SDG 16 campaign. And we have Matilda Baudet, Technical Officer at the World Health Organization's Health for Peace initiative, that supports efforts that link public health interventions with peace building in fragile and conflict affected contexts. Now, let's begin with Dr. Moses Izuba. So, Moses, thank you for joining us. And I have a question for you. How are you and your organization using storytelling in your work to implement SDG 16, including through interlinkages with the rest of the agenda? And something that really interests you, with traditional development aid in sharp decline, particularly following the USAID freeze and budget rollbacks by major Western donors, how can civil society organization in the global south reimagine their strategies in an integrated way to remain resilient, mission driven, and locally rooted? What practical steps are you seeing or taking to ensure that communities continue to access essential services and support despite these funding shocks? Over to you, Moses.
Thank you, Justina, and thank you everybody for the opportunity to speak on this subject, which I think is really very critical at this time. Storytelling, and here we should be talking about authentic storytelling. I think for quite some time, our story has been told by some other people. Now it's an opportunity for us to tell our own stories. And as Uganda National NGO Forum, which I lead, we place a very high premium on the value of authentic storytelling. And so in terms of our work, we do have what we call communities of practice. And in these communities of practice, we bring people that are working on the same theme to be able to tell authentic stories around aspects of health, around aspects of education, and on aspects of corruption as well. And so we think that those communities of practice are very good spaces for authentic storytelling. And of course, as Uganda National NGO Forum, we have our model of working with communities, and as a way of really driving down the SDGs is what we call the top power forums. Now, top power local work, and in these power forums, the communities organize themselves in fireplace conversations. And in these fireplace conversations, there are spaces for triggering community change as people discuss these matters that affect them. And one other way is really, which we have actually found to be very pivotal in terms of storytelling, is the continued media engagement and campaigns on these different issues. And where we are able to capture the voices of communities. We totally persuaded that this storytelling enables communities to be able to use their own voices and for us to leverage their voices. Because everybody has got a voice, all we need to see that it's only a few of us who have got the mic. So we are trying to democratize the microphone. We're trying to make sure that the voices of the people come out. Nobody is voiceless. So we think that that's really how we've been able to tell authentic storytelling, and the value which it comes when it, especially at the subnational level, for accountability purposes, and also for improving service delivery at the national level. Now, let me maybe shift gears a little bit and talk about the aspect of the freezing. I mean, the fact that USAID was fed to the wood chipper, as Elon Musk said, and then all of a sudden the whole world was kind of like living in a world of, it's like a big funeral, as it were. We all know that, and I've said this to many of my friends, that USAID money was large, sweet, and addictive. And so right now we are like recovering from the addiction. And so the suffering that you see around the world are withdrawal effects. The world is some sort of a rehab, a big rehab. But we are going to be able to manage and recover fully from these convulsions, these epileptic convulsions, which are rising out of the demise of the largest aid apparatus, which is USAID. So what we actually trying to do is, we know that as organizations, we have to continue delivering on our mission priorities. And so we are working with communities, trying to give a new face, give a new energy to community philanthropy. We have always known that communities have got community assets. They've got some, and these community assets is money, is skills, is relationships, and local competences. And we think that these are really important. So what we're actually trying to do since the death of USAID, which was actually followed up by other donors cutting their aid, was to work with communities much more so that we can see how we can leverage these community assets. And by leveraging these community assets, we are able to trigger community voice and community power, which means that communities then can be in charge of their own development agenda. The other way that we have also tried to do to try and see if we can plug this gap albeit not with much success, is to try and speak to the private sector, because the private sector, many of these private sector companies will have their corporate social responsibility initiatives. Now, what we are trying to talk to them is that it's important as a telecom company, as a bank, to be able to invest in an organization like ours, which might actually be looking at governance and democracy influencing. A lot of the money that has already come from the corporate social responsibility goes often to service delivery organizations, the ones that are putting up schools, putting up clinics, and very little goes to the governance and democracy influencing. But the conversation that we're having now is that private sector companies need to appreciate that governance focused organizations are playing a critical role. And so we think that is one way that we can actually be able to plug the gap with collaborations with the private sector. The other important aspect is really to try also work more and sort of like turbocharge the conversations around locally led development. And here we're making sure that then the organizations are able to be in charge of their development agenda. That are able to ensure that everything is being done, from the aspect of the community's lens. And so, yeah, those are some of the efforts that we are trying to do as we try to see how we can survive the decline in the aid industry, or the death of the aid industry. Yes.
Thank you so much, Moses. I think you have finished your delivered. Okay, I think we cannot hear Moses, but it's really nice to hear. Moses, you talk about giving voices to the voiceless and giving mics.
Justina, I thought I was pausing because I thought I responded to those two questions. So I felt I needed to pause. Yeah.
Thank you. Thank you so much. Yeah, yes, Moses, you are right. And you have almost answered all the whatever we wanted to ask. But, since you're going to meet a donor, so can you just say very briefly, maybe in a minute, what is the role of other donors and how can they support SDG16 interlinkages across the agenda?
I think it's very important that we all donors understand that SDG 16, which is really focusing on peace, justice, and functional institutions, perhaps is the most important. I mean, I dare say that the success of us to be able to deliver on the finishing line is where people appreciate that the functionality of institutions is so important. And so I think there's going to be need for partnership and collaboration to ensure that ensure the sensitization around it. What we need to call on all donors and all institutions is to prioritize SDG 16 as an enabler, because I'm looking at SDG 16 as an enabler for the realization of the 2030 agenda. And because of the importance of these institutions, we need to be able also for donors to be able to support flexible, cross-sector initiatives that can integrate peace, justice, and strong institutions together with other SDGs like, that are focusing on health and economic inclusion. That's really important. So I think it is a clarion call that I want to make to all donors. Yeah.
Thank you so much. That's very important to make SDGs as an enabler, accelerator in a true sense. Thank you so much, Moses. Now I will move to our next speaker. And very welcome, Leonie Mutioni. So my question to you is, how are you and your organization using storytelling in your work to implement SDG 16, including through interlinkages, and with the rest of the agenda? And in your work, how is gender equality relevant to access to justice and women's participation in legal and justice sector? And how can stories about this work serve to combat anti-rights and anti-gender narratives? Over to you, Leonie.
Thank you, Josna. Am I audible?
Yes, loud and clear.
Okay, great. Greetings, everyone, wherever in the world you are joining from. As Jyotsna just said, my name is Leonie. I work with the Legal Aid Forum in Rwanda, which is a non-state legal aid service provider. And our work centers on promoting access to justice for vulnerable and marginalized community through legal aid provision, legal education to raise awareness of rights, but also research to support evidence-based advocacy for legal and policy reform. It's an honor truly to be part of this conversation, which is so relevant to our daily work. And I'm also excited to learn from all of you. So I would like to start by tackling storytelling, since that was your first question. And storytelling, I think, is such a powerful way to share best practices that can be replicated and adapted across contexts. It can inspire action, strengthen advocacy, and really connect people across borders. And often it's the stories, not just the statistics, that can leave a lasting impact. And at the Legal Aid Forum, we regularly use storytelling, mostly in form of like short documentaries to capture and share our work. One of them, which Josna mentioned earlier, was selected as a finalist in the 2023 Voices of SDG16 Plus campaign. And it basically focused on our legal aid call center in Kigali, which is a platform that provides free legal advice across the country, including to people in remote or underserved areas. And this innovation has really helped us to reduce common barriers to accessing justice, especially in remote areas, things like long journeys to find the nearest legal aid service provider, high transport costs, but also limited awareness of legal rights. From this platform, people can call us free of charge from the comfort of their home and speak to a lawyer about a particular issue. So since sharing this story, we've had organizations reach out to learn from our model, including partners from Malawi, Sao Tome and Principe, Zambia, even some organizations within Rwanda itself. So that kind of interest really goes to show that storytelling isn't just about visibility, it can also be about scaling impact, because people can replicate from the best practices that you are sharing. But we have also used storytelling to uncover injustices that might go unnoticed. For example, one of our other short documentaries highlights the barriers that persons with disabilities face when they are trying to access justice. So things like court buildings, for example, that aren't wheelchair friendly, the lack of sign language interpreters during legal proceedings is a very big issue. Or the fact that even most legal information isn't available in Braille or audio formats. And these might seem like technical oversights, but they can make justice feel entirely out of reach for some people. And the reality is many people don't even know that these barriers exist, because unfortunately, sometimes if you haven't been through a thing, you just don't think it exists. And storytelling helps to bring these experiences to light, because when you put a face and voice to the issue, it's no longer just a statistic. It becomes more real, it sticks with you, and it can even spark change, whether in policy, in attitudes, or even in funding priorities, because we have also seen how a well-told story can support fundraising by offering a tangible human view of the impact of the work that you are doing. You also asked to speak on the relevance of gender equality and access to justice. I'm very happy to speak on this because it's literally our daily work at the Legal Aid Forum. And from our experience, we've seen that gender equality is actually essential for access to justice that everyone, regardless of their gender identity, has the same chance to understand their rights, to seek redress, and be treated fairly within a legal system. And a key part of making that equality is either upheld or denied. And that's why civil society spends so much time pushing for reform, because when laws are just, then real change can begin to happen. So if we take something as example as a girl's right to education, for example, in some places, laws still exist that allow for child marriage. That means that a girl might be pulled out of school at 14 or 15 to become someone's wife. The law in that case is actually standing in the way of her future. But when countries have strong child protection laws and clear marriage age limits, that same girl has a better chance of staying in school and building a life of her own, or on her own terms, rather. So in Rwanda, where I'm from, our constitution sets a minimum of 30% women in leadership roles in institutions. Of course, that's not the goal. We still have some work to do, but it's a starting point that is made possible by the law, and it has made a difference. Currently, we have over 60% female representation in parliament, and it's one of the highest in the world, I believe. Of course, numbers alone don't fix everything, but they do create space for women's voices in places where decisions are made. And that space only exists because there's a legal foundation that made it possible. And again, another reason why legal frameworks matter, especially for civil society, is because it gives us something solid to stand on when we're doing advocacy. So if a law prohibits gender-based discrimination, then we can refer to that law to challenge injustices
Can you hear Leonie, or am I
I
the
think
only
she
one who
froze
cannot
on
hear
my
her?
end as well. I can see her. I can't hear
Okay.
her.
Yeah, from my end too.
Okay. So yeah, we'll get her when she's back. Um, Maybe we'll now move to the third panelist, and Leonie remarkably said very well.
I think she's back.
sorry, I think I lost my
Okay.
connection at some point.
Oh yes.
I don't
So
know
sorry
where you.
about it, Leonie.
My bad.
You, no, you can. You were talking about the stories in Rwanda and the age limits and girls' education.
Oh, yes.
Maybe.
I was saying earlier that laws can create an environment for gender equality to either be upheld or not. And I was giving girls' education as an example, saying that in some places, in some countries, we still have laws that can allow for child marriage. And in these cases, a young girl of 14 or 15 can be pulled out of school to be someone's wife. And in that context, the law is actually standing in the way of her future. But when countries have strong child protection laws, that same girl has a better chance of staying in school and building life on her own terms. But specifically speaking on Rwanda, our constitution sets a minimum of 30% women in leadership positions in any organization, which that is not the end goal. We still have a lot of work to do, but it's a starting point that's been made possible by the fact that we have a legal framework for that. And also same for our female representation in parliament is about 60% now. And while numbers don't fix everything, this kind of representation gives space for women's voices in places where decisions are made. And that place exists because there's a legal foundation that made it possible. But I was also sharing that another reasons why legal frameworks matter is because they give us something solid to stand on when we're doing our advocacy work. So if a law prohibits gender-based discrimination, then we can refer to it to challenge injustices like a woman being denied land or inheritance, etc. Because the law provides the tools for people to speak with, and it gives us something to basically demand accountability with. However, all that being said, laws alone aren't enough. People need to know their rights within these legal frameworks, and duty bearers also need to enforce those laws. And this is a gap that we see often. So at the Legal Aid Forum, a big part of our work is legal education, especially in rural areas. We've met women who didn't know they had the right to inherit land or didn't know that they could get help after experiencing domestic violence. And when they find out that these protections exist, it's not just empowering, it can even be life-changing for them. And of course, there's also the issue of who's delivering justice, because you asked me to speak about participation of women in legal institutions. And we've seen that having more women in legal institutions or in the justice sector as a whole, whether they are judges or prosecutors, community-based paralegal, having them can really shape the outcomes. Just to share an example, at the Legal Aid Forum, we have seen firsthand that women survivors of GBV, for example, feel much safer opening up to a female legal aid provider than they would to a man who sometimes they can feel like is a perpetrator. And so just, for example, even having like a woman on a mediation committee, for example, in a village, it can change the tone of the conversation. She might maybe notice things that others overlook, or the victim will just feel like she has more space to speak freely just because she sees there's another woman there. So these are small shifts, but that can lead to big impact. And when it comes to interlinkages in SDGs, I think SDG 5 and SDG 16 are deeply, deeply interconnected, because we can't talk about building peaceful, just, and inclusive societies without addressing the inequalities that keep the half of the population from fully participating. And likewise, we can't talk about gender equality in a meaningful way without ensuring that women and girls have equal protection under the law and equal access to justice, and of course, a voice in how those systems are shaped. So when justice systems become more inclusive and responsive, we create the conditions then for gender equality to take root and thrive. And I think I will just stop here. Thank you so much for your time.
Oh, thank you so much. You've been so inspiring, and I love your story. And I see the chat box. It's all praises, and you rightly say that looking at small shift, having women in the committee or something, that really changes, and giving face and voice to a data. It's no more a data. It's so inspiring, Leonie. Just a very, very short question that I would like to ask you before we go to a next panel. It's just if you can answer in a minute. As a finalist for the 2023 Voices of SDG 16 Plus campaign, can you speak to the role of storytelling, written or visual, in communicating the work of Legal Aid Forum to bridge the justice gap in vulnerable communities with historically marginalized population? You already spoken some, but if you could just sum up in a minute.
Sorry, I think you broke off a little bit. Could you please repeat the question?
Yes, of course. If you can hear me. So as a finalist for 2023 Voices of SDG 16 Plus campaign, can you speak to the role of storytelling, written or visual, in communicating the work of Legal Aid Forum to bridge the justice gap in vulnerable communities with historically marginalized population? Can you hear me, Leonie? I think
we might have lost her.
we
But
have
it's okay.
lost her.
Yeah. She'll come
Yeah.
back. Don't worry.
Yeah, she'll come back. Thank you so much. But she's been really good. I just wanted to ask her one last question, but when she's back, we'll ask her. And now we move to the last panelist, a very, very impressive and powerful panelist, Mathilde. Thank you. for for waiting. I know it's going to be powerful because it's going to be the last one, and I have some questions to you, especially in regard to health and peace initiative. So, how is the World Health Organization using storytelling in the work to implement SDG 16, including through interlinkages with the rest of the agenda? And also, if you could provide us with some tangible examples of the integration of health peace that the initiative has accomplished so far, and what impacts have you seen, and what is the role of joint messaging and cohesive narratives in achieving these impacts? Over to you, Mathilde.
Thank you so much. Good morning, good afternoon, good evening to all participants. And thank you so much again to the organizers for inviting me to speak at this very interesting conversation. I will try to answer your questions as best as I can, Mohan, but I have to say it's quite difficult working at headquarters to have as many local examples of practical stories or storytelling. I will rather focus my experience sharing today on how we make the links between SDG 16 and another SDG, which is SDG 3, on health and well-being. I've got a few slides that I'll share with you right now. Let me know if this works. Can you see my screen?
Yes.
Excellent, thank you. So let me first maybe walk you through the links that exist between health and peace, or between SDG 3 and SDG 16, since today's session is about those interlinkages between the SDGs. First, looking at the negative, it's unfortunately the obvious one, but it might be good to remind that violent conflict is not just about causing harm, physical harm to people's lives even, but also to health systems. And it's huge. And we are unfortunately seeing this extensively today in different places, including Gaza and Sudan, to another extent, Ukraine. I think it's good to keep in mind that the whole system is being shaken, and it takes years to rebuild and to make health systems resilient. It's about the medical supply chain, healthcare workers living, or healthcare workers in healthcare buildings being attacked. And of course, related to mass displacement of populations, to lack of access to clean water, upsurge in disease outbreaks, and food insecurity. So that's one. Now, conversely, obviously, peace is considered a social determinant of health, as we call it. And so when we look at, from the health point of view, health equity and robust health systems do foster social cohesion and trust. And peace is a factor or a social determinant of health equity or equitable access to health care. So it's a positive, it's a virtuous cycle, as we call it. And it's also worth stressing that there's a growing body of research suggesting that healthy communities are more likely to engage in peace-building efforts. Again, this may look like we're stating the obvious, but this is all very well documented, and it really, I think, illustrates how health and peace are connected on both sides of the spectrum. And obviously, this is recognized at policy level. It's first stated in the WHO's constitution, and in this case, looking at the fact that health is fundamental to the attainment of peace and security. The Ottawa Charter for Health Promotion looks at the interlinkages the other way around, mentioning peace as one of the first prerequisites for health, so peace as a social determinant for health. And then more recently, of course, our work is also connected to the HDP nexus, and WHO is committed to contributing to SDG 16, mainly through the entry point of the Sustaining Peace agenda. And I think the Global Health and Peace Initiative, which I lead at the technical level, is the illustration of WHO's commitment to the Sustaining Peace agenda. So what's the purpose of the Global Health and Peace Initiative, the GHPI? It's basically to strengthen or improve the role of WHO and the health sector as contributors to peace or to improving the prospects for peace. For example, we do so by strengthening the conflict sensitivity of health programs, which is the bare minimum we try to advance. Or where it's possible, we also try to have health programs that actively contribute some peace outcomes. Such as social cohesion, equity, inclusiveness, vertical or horizontal trust at community level or between populations and the authorities. So very briefly, the theory of change that articulates, I think, very well the link between SDG 16 and SDG 3 goes as such: if individuals and groups enjoy equitable access to health services that fulfill their rights to physical and mental health, if health actors design health interventions that promote trust and dialogue, and communities are empowered to cope with violent conflicts, then health coverage is more universal, which is a major goal of WHO, obviously. Grievances can be heard, and health-related grievances can be heard, but also more generally, and addressed to generate trust regarding emergency health concerns. Affected communities are more likely to make meaningful contributions to peace and reconciliation and resist incitements to violence. By improving citizen-state cohesion through health equity and dialogue or participatory policymaking, by facilitating cross-line cooperation in health governance, and promoting health and well-being through dialogue and inclusion. So here we're trying to capture a very complex or a long list of possible entry points that I'll detail a bit more later that connect health and peace objectives, but it gives you, I think, a good overview of how we're trying to achieve that. And so a major tool for that is, I would say, at the center of the Global Health and Peace Initiative is what we call the health and peace approach to programming. So everything else that we're doing is trying to support this objective of sort of mainstreaming this approach in WHO's programs. And so, as I've sort of mentioned briefly earlier, it's about one, ensuring peace and conflict analysis being done in the assessment phase and project design phase, and two, ensuring conflict-sensitive programming that I don't think I need to explain here, as I believe the audience is mainly made of peace builders. And three, where appropriate, and it's not always possible, we try to promote the pursuit of peace objectives or contributions to peace objectives. That's what we call peace-responsive health programming in this case. So what does this look like? What sort of peace outcomes can health interventions or health policies contribute to? So on the left, you've got possible peace outcomes, and on the right side, you've got activities that can contribute to those. So without going into all details, you can see we're working out on reducing exclusion and strengthening trust between populations and the authorities. It can be at very macro policy level by ensuring, first and foremost, universal and equitable access to healthcare. So that, I would say, is an example where WHO's work, WHO's mandate per se, is a contribution to sustainable peace in societies. In other cases, such as when we try to reinforce social cohesion between or within communities, we may design health activities that are a bit more oriented toward peace building. I would say more actively, more directly oriented towards contributing to peace building, such as, for example, what we did in Cameroon, opening community dialogue over health needs and health services, making sure that dialogue is inclusive, is carried out in an inclusive and participatory manner, building bridges between groups that would normally not talk to each other anymore. And it's really resulted in very positive social cohesion outcomes between IDPs and host communities, for example. Or in Somalia and in Burkina Faso, We've designed mental health and psychosocial support interventions with funding from the Peacebuilding Fund that really aim to support reconciliation and the reintegration of youth affected by conflict. So these are examples where we're really trying to integrate peace-building objectives into our programs quite directly. And there are multiple other examples, which I'm happy to walk you through or illustrate later during the Q&A, but you can see here on screens other illustrations of that. Maybe I can also point out what's in blue here about the temporary humanitarian ceasefires. So obviously it's not a peace building, I would say, contribution, but it's definitely about negative peace, about temporary suspension of violence, which is highly important when you're actually in affected communities. And so whether it's WHO or whether it's other stakeholders negotiating days of tranquility like was done in Gaza at the end of last year to facilitate humanitarian access can also be considered a contribution to peace, but in this case, to negative peace of a health intervention at higher level. Now, I've got less to say about storytelling per se, but definitely there's a few points that I would like to share with you in terms of how we advance, how we promote the GHPI through our awareness raising and advocacy efforts, and the challenges and the opportunities we face as we try to actually bridge the gap between SDG16's world and SDG3's world, which are very different worlds, different working cultures, different sort of background of the people who work in these two sectors, if I can call them like that. Different fora, different stakes. So that's what we at headquarters working more at policy level are facing pretty much on a day-to-day basis. First, I would like to highlight the opportunities. Obviously, the Sustaining Peace Agenda is one of the reasons why we're doing this, and it remains a key tool for us to explain, to promote, to justify the work that WHO is trying to achieve through the Global Health and Peace Initiative. And so is the Humanitarian Development Peace Nexus, obviously. And with that regard, we've often joined hands with other UN agencies, be it FAO, IOM, ILO, UNDP, UNICEF, UNFPA, etc., to advocate again and again on the relevance and importance to maintain or increase support on UN agencies' works towards implementing the Sustaining Peace Agenda. So of course, it's not necessarily just about SDG 3 and SDG 16, but all other SDGs that those agencies are working on respectively, and the links we're trying to make between our respective technical mandates and SDG 16. And I think that has been very useful. And in fact, we've all been obviously invited to contribute as civil society organizations through other channels to contribute to the UNSG reports on peace building and sustaining peace. And the latest one does highlight the interlinkages between peace, conflict, and health, which I think is a great achievement and a great sort of policy reference for our work. WHO senior leadership also promotes the links between health and peace at much higher level. I think the DG, Dr. Tedros, has been very vocal on that. And at more technical level, without saying that we do have a lot of storytelling, we are, of course, trying to document good practices and then share that knowledge and build common knowledge around those practices on health and peace programming. Would very much like to go further and develop a real community of practice. I know there's actually interest for that. But one of our limitations or one of our challenges is the lack of means right now, and the current financial crisis that we're all facing is definitely not helping, obviously. Amongst other challenges, so I was sort of referring to that, we are trying to generate evidence, but it's still lacking evidence on the links between health and peace, or the evidence of the positive results of health and peace programming, integrated health and peace programming. It's still lacking, I would say, to be honest, although we've already got a few. We would very much like to be able to collect more local data on this, not just from WHO country offices that we are already in touch with, but also from local organizations who may be working on this. It's also worth stressing that, and this is not specific to health, but documenting the dividends of peace per se is not that straightforward. The positive impacts of peace on health policies and healthcare might seem to be quite intangible. It's not easy to make a direct connection between the two. So that is also a challenge we're facing. But it's often easier to demonstrate the link through the negative, demonstrating the negative effects of armed violence on health systems and healthcare, and that is highly recognized, obviously. Now, the last challenge I would like to highlight are existing resistances that I was sort of referring to earlier. Knowledge, working culture, language are so different between the peacebuilding world or the people working in peacebuilding and people working in public health. There is a real gap. And because there is this gap of knowledge and perceptions of what peacebuilding is or or how public health can contribute to peacebuilding for peacebuilders, we are facing various concerns, I would say, especially from the health sector. Obviously, I would say the peacebuilding world is quite happy to hear that any UN agency that has a development or humanitarian mandate is trying to contribute to their work. And they're quite welcoming this. But the health sector, especially the humanitarian, I would say, sort of section of the health sector, sometimes raises concerns as to how this may jeopardize the neutrality or the impartiality of healthcare, or whether this could actually result in politicizing healthcare. And so do member states. The WHO member states did express reservations about those risks. There's also a concern about whether this could become a burden for health workers. But our messaging has always been not necessarily, because we're talking of linking health and peace at programming level and at policy level. So it doesn't really rest in the hands of the health workers. They can engage, they can work at least in a conflict-sensitive manner. That's at least the bare minimum, but we're not expecting healthcare workers to open dialogue between conflicting communities. That would rely on, indeed, on peacebuilding partners to do that while we conduct health and peace programs together. So anyway, lots of resistances, but we are trying to bridge the gaps. And my last few slides are trying to just provide one illustration also of how we try to adapt our communication. For example, this is an adaptation of some previous slide that I showed to you, like this too, on what we can do to link health and peace. Often people will not understand if we start talking of peace outcomes when they are working in the health sector. So here, for example, this is a communication tool that we've got for internal or external purposes, where the entry point is the situation you're working in. In an active conflict, here's what you can do. In a setting where there is distrust between populations, authorities, and health staff, or whether there are rumors, here's what you can do that contributes to peace or social cohesion. And I should have stressed that earlier. This is very much the sort of level we're working at. We're not talking of peace with a big P, as we say, but rather of working towards social cohesion and trust building. So we try to adapt our communication tools and our messaging, and we do need to reassure the humanitarian sort of section of the health sector that conflict sensitivity is mainly actually going to be helpful to maintain neutrality and impartiality more than becoming a risk. And we're also very clear that the pursuit of peace objective is not always appropriate. And in certain settings, this is not something that may be reasonable to do for different risks, including political risks. So we're very cautious, we're very aware of that too, and we're trying to not be too pushy with this regard. So that's also part of our narrative, if not storytelling. Thank you very much. Over to you.
Thank you so much, Matilda. This is very, very inspiring, and you have rightly connected the peace and health, and and I really like the concept of positive peace and negative peace. I heard long time ago, and it would be really nice to hear such concepts because that really exists here. And thank you so much, and we'll get back to you with the questions after this session. Thank you once again. And I wanted to give floor to Leonie. I think you're back, Leonie. Are you here? Can you hear me, Leonie?
Yes, I'm back.
Amazing. Nice to see you. So I'll go back to my last question to you. And if you could respond in a couple of minutes. And this is, very related to your work. As a finalist for the 2023 Voices of SDG 16 Plus campaign, can you please speak to the role of storytelling, written or visual, in communicating the work of Legal Aid Forum to bridge the justice gap in vulnerable communities with historically marginalized population? The floor is yours, Leonie.
Thank you, Jyotsna, for not giving up on me, and apologies to everybody. I literally tested this platform before the call, but leave it to technology to disappoint at the very last minute. But to answer your question, which I think is very relevant, so several justice issues that affect marginalized communities, things like GBV or land grabbing or lack of documentation, etc., they go underreported or even misunderstood. This is something that we have come across quite a lot in our legal education campaigns. So storytelling is a good tool to bring these hidden injustices to light. Whether in form of video or written material, storytelling just helps us to amplify the voices of those who are often left out of mainstream narratives, and it allows us to create public awareness of these very real issues. But also legal aid by its nature just deals with technical and legal complexities. So storytelling can help to translate these into human experiences, because when we share lived realities of people, when we are able to put a face on systematic issues, it can demystify the justice system. This is especially critical in rural areas where formal legal processes may be feared, misunderstood, or even perceived as basically inaccessible. So when you do storytelling, it allows people to see others like them navigating the system successfully. So I'm saying it can demystify the justice system. But also lastly, donors and partners often look for evidence of impact beyond numbers. And storytelling allows us to do just that. We are able to illustrate how the different interventions are improving people's lives. It adds depth, so to speak. It adds depth to like monitoring and evaluation reports, because it can communicate outcomes in a way that charts and graphs cannot. Yeah, thank you.
Thank you so much. This is very interesting, and I hope our participants have listened. And if they have some question, please put in the chat box, and our panelists would be very happy to answer your questions. So thank you, Leonie, for again, coming back, and for a very inspiring speech. So I wanted to thank to all the speakers for your insightful and thought-provoking remarks. We now have about 30 minutes for question and answer session, which gives us a great opportunity to dive deeper into some of the themes that have emerged and hear from our audiences as well. So I'm now very happy to hand over to my colleague Elise, who will moderate the Q&A. Elise, the floor is yours.
Thank you so much, Jyotsna, and I hope you can hear me well. Thank you very much for the great interventions. And I think this was very, very insightful. There's already a few questions in the chat box. So I'll just let some come through, but there was one that I wanted already to ask, and maybe that was also more directed to what you referred to, Matilda, about one of the challenges around language, which you also referred to, that the health sector and then the peacebuilding sector might not use the same languages. So I was wondering if you have any thoughts or also advice on this, on how to remain also flexible in the language, to speak also then to different sectors, but also to different audiences, and then how we can collaborate better through that.
Thank you so much, Elise. Yes, I think you're really putting your finger on a very important point, flexibility in our language. And in fact, so I come from the peacebuilding sector, by the way, just as a matter of information. And so I would say that at individual level, because before saying at organizational level, I have faced that language challenge myself, probably. And then embracing the organizational culture progressively, I think I came to realize that I definitely had to drift away from my
peacebuilding, not culture and mindset, that would be too strong, because that's why I'm here for. I'm here to bring my peacebuilding expertise into WHO's work. So it comes with language, but definitely to move away from specific terminology and jargon. And to be honest, we're still wondering sometimes if we have to stick to the words conflict sensitivity, peace responsiveness. And I know that some UN agencies have actually moved away from that. I can't remember what they say exactly, but for example, in our case, we've started to replace the word conflict analysis by using a paraphrase, less catchy, but maybe more understanding, saying introducing conflict analysis in the assessment phase, something like that. So while you do your public health assessments and in general in your assessment phase and project design phases, you need to make sure you include conflict analysis and to do no harm. Again, trying to replace maybe conflict sensitivity by another sort of buzzword that is probably a bit more known because it's less peacebuilding jargon, I would say. And I think it does work. The only reservation I've had with moving completely towards using those other less peacebuilding sort of labeled sort of language is that it's also not advancing the spirit of the sustaining peace agenda more as actively as I think we should be as an organization. If we say we want to contribute to the sustaining peace agenda, then in a way we also need to be consistent with ourselves and embrace that language and embrace these sort of approaches. And I think we can proudly say that things have evolved within WHO since the time the GHPR was launched in 2019 and today. I think many more colleagues across country offices are now familiar with those concepts. And depending on the context, but also depending on personal sensitivities, personal stories, whether they have been exposed to conflicts themselves, some really want to actually embark on this with us and pilot projects that actively connect health and peace. I hope that answers your questions. Probably only part of the answer. There would be a lot to say. It's a huge challenge, but it's also be thrilling to try and really mainstream those peacebuilding
approaches and peacebuilding language while remaining flexible and certainly adapting the way we explain concepts by using the relevant entry points. I think that's it. You need to adapt to your audience in any communication exercise. So we try to do that. Yeah.
Great, thank you. I think that does answer the question and still remains a task for us all in that sense also. I see a few questions, so thank you everyone, and please feel free to continue putting questions in the chat. Also, I see that there was some, not everyone got the translation on, donc si vous avez des questions, n'hésitez pas à les mettre dans la boîte de discussion et je vais essayer de faire mon mieux de traduire les questions. I'll mention 3 questions that I've collected in the chat, and then I'll let you, Mathilde and Leonie, answer as you see fit. So one was a question: how does health fast track SDG16? And then another one was related also: how viable is crowdfunding an option for storytelling? And then another question, I think this was also more towards Leonie, but the issue of early marriage for girls below 18 years old poses a great challenge to the achievement of girls and child rights to education opportunities. So what is the effort to correct this anomaly? So I'll start with these questions. And I see, Leonie, you have maybe your mic open, so I'll give the floor first to you to answer the questions here. I hope that you are still able to hear us.
Yes, I can hear you at least. But is it okay to keep my video off? I think it's interfering with the connection also. Yes, but someone asked the issue regarding child marriage and what efforts can be made to correct this anomaly. So I would recommend advocacy, although that sounds so broad, but maybe like a research assessment that highlights what these issues are. Even storytelling, whether it's in form of documentary or some written material, it can also bring to light these issues that people are not aware of. And then you can use that to sort of advocate for such a provision within the law to change. And maybe I can relate it to what we did at the Legal Aid Forum, although it wasn't specifically child marriage, but we did conduct kind of like a legal audit on our legal framework just to see how our country is implementing gender equality commitments. And we looked at the different laws that we found some discriminatory provisions. And one of them was that when it was this provision in the family law, actually, whereby if a woman loses her spouse, like if her husband passes away, she would have to wait.
I think we lost you for a
bit. To
bit.
deal with this. So when we conducted that assessment, this legal audit, and we were able to
I think we lost Leonie. I'm not sure if on the other device that she might be connected. You're back.
Sorry, yes, I was saying when we did that assessment and we had all these findings and recommendations, we were then able to engage lawmakers, we were able to engage other civil society organizations to kind of help us, you know, raise our collective voice on this issue. So I would recommend doing some kind of assessment, some kind of legal audit, and then use your findings to then demand or advocate for legal reforms, because its legal frameworks are really the basis of everything. And if a legal framework is supportive, if they can remove such a provision, then I think it's a very good way to start. I hope that addresses the question.
Great. Thank you, Leonie. I think it does. Then there were two other questions. I think one can maybe more directed to Matilda on how does health fast track SDG 16?
Yes, thanks, Elise. Well, I think I may have partially addressed the question in the meantime during my presentation, but I'm happy to elaborate on this again, because this is the core of this conversation at the end of the day. First, at macro level, at really, like, I would say policy level. So sorry, let me go back a little bit. When we say health, it's health, but it's also health policies, I have to say. It's not just about, yes, good health contributes to peace, or I said at the beginning, healthy communities are more likely to contribute to peace building efforts. That's true. But mainly our point here is to say that health policies can also be more actively contributing to peace outcomes, or already contributing to peace outcomes, and we need to recognize that and to strengthen and document that and improve it along the way. So first, as I've mentioned, for example, one of the key objectives of WHO is universal health coverage, and through this, equitable access to healthcare. That per se, I think, is a key component of the social contract between any population and a national government. And I think it is a major contribution to sustaining peace, as any other equitable access to any sort of basic services, education, access to water, to clean water, definitely access to healthcare, equitable access to healthcare. Now, looking more at maybe more community level, for example, I've given the example of mental health and psychosocial support interventions that are a clear example of how mental health, in this case, mental health, contributes to reconciliation. But again, those interventions need to be designed in a way that they are conflict sensitive and that they really try to integrate those reconciliation efforts. And I think in Rwanda, in your country, Leonie, where I used to work as well in the past, some organizations with the national government have done great work at linking mental health and psychosocial support efforts and the reconciliation and peace building process in the country. Another effort, and I think somebody put that in the chat, and thanks for that, is another example, is, for example, when you use health, well, let's say you create opportunities for peace building through health activities. Example, when you do a disarmament, a demobilization, disarmament, no, the other way around, disarmament, demobilization, reintegration program, DDR, you may want to reintegrate healthcare workers from armed groups into the formal system. And that happened in various countries already. I think it might have happened, for example, in Colombia, and it did in various countries. There's a different way, I think, of thinking here of the links between health and peace. Again, it's not health per se, it's not either a health policy, but it's us as a health actor designing activities, health activities, in the way that we want them to contribute to an reintegration process / a peace building process. And another example that's less straightforward that we've done in Cameroon, for example, is creating community health workers, implementing training for future community health workers, accessible to youth exposed to enrollment in armed groups, for example, who are likely to be enrolled, for example, in Boko Haram in the far north of Cameroon, in the case of the project I'm talking about. And it really is important because those youth, when often they are exposed to the risk of enrolling into those armed groups, they are actually looking for belonging to a group. They're looking for a role to play in their community. They're looking for something to just to do sometimes, that pays ideally, but also that gives them sort of a value in their community, that gives them a role. And if you give them a positive role, if you offer them this opportunity, you're preventing violence, or you're preventing them from joining those groups. So yeah, these are some illustrations of the possible links. So some are pre-existing by nature, but some we also sort of build them proactively because we want to contribute to the Sustaining Peace agenda.
Thank you so much. There's also some questions more around funding, and maybe it's also how we can apply the joint narratives towards integrated funding mechanisms. Also now, especially with the USAID cuts, would this also then be seen as an opportunity to maybe also bring in other funds, but maybe that we put it differently by having joint narratives? So maybe over to you, Leonie, if you have any thoughts on this first, and then Mathilde. Hoping that you can still hear us. Maybe I'll pass it over to you, Mathilde, in the meantime, hoping that Leonie is able to join us.
Okay, I'm happy to jump in. I hope Leonie can still join us indeed. Yeah, well, yes, that's a very good question. Integrated funding mechanisms. Obviously, I mean, I think that's one of the messages that the humanitarian development and peacebuilding communities have tried to articulate to donors, at least for those who are the most supportive of the triple nexus. It really remains to be developed, and I guess it's right. It's probably right to think that the stopping of US financial support in our sectors is going to change, to drive change in the funding networks and in the way donors articulate their priorities. They will probably have to articulate them across the nexus a lot more than they used to. But I can't say we don't have a policy on that. We haven't developed any specific fundraising objective on this issue, but it's definitely something that we've been discussing with donors and with partners on regular opportunities, like with other UN agencies, as I've mentioned earlier. I don't have any information on any possible shifts that's coming up right now, but yeah, I guess it's a likely scenario, and it would be very, very welcome indeed. As we often say with this tragic situation, it might be something bad, but that opens up the way for positive change, some more sustainable practices in our sector. So maybe that's one of them.
Yeah, thanks. Thank you for that. I hope, yeah, I see that Leonie jumped out, but I hope she'll come back to us. Then there was also one specific question, if you have any thoughts on this, also how to, what can be done to also encourage more people or organizations also to be engaged in peace building through storytelling. Yeah, as there can maybe also misunderstanding on the concept of peace.
Sorry, can you repeat?
On what can be done to encourage more people or organizations to be engaged in storytelling, to be engaged in peace building through storytelling. Also knowing that peace building can also be then a misunderstood or diverse term.
Mm-hmm. Well, I would go back to what Leonie said earlier, and indeed, I don't think policymakers, donors can only be convinced on the importance of sustained support to peacebuilding efforts or to SDG16 through mere numbers. They need qualitative data because peace building is more qualitative than quantitative, and that's sort of the drama, the dramatic nature of our work. It's to be able to promote it without necessarily having numbers at hand. Yes, of course, we can always say we've reached out to 10,000 people in this community, or 500 people joined our dialogue committees, whatever, but this is never good enough when you talk about peace building. So yes, I think it's actually extremely important, and I actually wish we also had the capacity ourselves to provide more stories on how healthcare or health policies contribute to peace outcomes, because oftentimes people need illustrations. Peace building often comes across as something very abstract to many different sorts of audience, certainly in the health sector, but even more generally speaking. People think peace is the absence of war when they first hear this word, if they are not familiar with peace building. And it's not just the absence of war or violence, it's a lot more complex. So I think we need to illustrate that's through storytelling, and mainly, I guess, storytelling at the community level, talking of peace with a small p, of social cohesion, because so far overlooked. It's, again, I think the perception that people have of peace is first the absence of war and violence, and second, it's peace at political level, ceasefire, peace agreements, and it's far from just being that. It's a lot more systemic, and a lot happens at community levels. I think storytelling is a powerful tool to explain what this means, and then to promote the importance of it. So yes, absolutely agree. And I think we have to do a lot better in our own work and promoting the GHPI, on that. Thanks.
Thank you, Mathilde, and thank you for answering all these questions, and to Leonie also, who will hopefully be able to rejoin us. And thank you also to all the participants who have asked their questions, but also giving their inputs, and also from their perspectives, and also how they've also worked with storytelling, and how that can also being used across the different fields and sectors. We'll end the Q&A section now. So I know there were more questions, but we're also about to get close to time. So before that, I'll give it back to my colleague, Elena.
Great. Thank you so much, Elise, and thank you to all of our speakers, and to all of you for your questions in the chat box as well. I'm just going to share two kind of visuals for us as we wrap up this conversation, and maybe just to share a couple of kind of takeaways that I'm walking away with, thanks to all of our wonderful panelists, is that this conversation has really demonstrated to us that amid downward trends in funding for sustainable development and peace building, we really need to think creatively and innovatively in order to support our advocacy and our fundraising. And I think all of our speakers across their remarks have really shared the urgency and need for storytelling to be part of those creative and innovative approaches, in the way in which stories can really help us highlight urgent needs that our communities are facing, but also can communicate the many transformative solutions, and in some cases, maybe even very, simple tweaks and changes to the way that we do things that can be really transformative. I think something I'm thinking a lot about is that, across what everyone has shared today, people do not live single SDG lives. They also don't necessarily, operate in the world thinking like, yes, I am receiving peace building assistance or conflict prevention assistance or development assistance, right? People aren't, they don't have an SDG checklist that as they go through parts of their day, when they go to the doctor, they're not checking off SDG 3. If they go, for legal aid or legal support, they're not checking off SDG 16, right? And so narratives in particular, and stories are part of those narratives. Narratives can be really helpful in communicating to broader audiences, the work that civil society organizations, UN agencies are doing in terms of addressing really tangible needs in communities. And I think also in part, stories can help articulate impact that's otherwise very difficult to document in data or figures, or it can also help to depoliticize issues or areas of work, but also can help unpack complex ideas, right, through like a personal anecdote or a personal narrative or story. And so a few maybe kind of key takeaways that maybe are things we can continue this conversation on is, one, thinking about engaging with the private sector and how can we adapt storytelling to these audiences as well, really demonstrating the impact and the value of investing in SDG 16 plus themes to support work collectively on fundraising. But also this idea of storytelling and scaling impact, how storytelling can actually help articulate best practices for other organizations or other colleagues to engage in as well. But then also this piece of storytelling as part of rights education and part of crafting narratives and shifting norms within our communities and societies. I liked this idea that like stories can show how other people like you, quote unquote, are navigating maybe similar issues or finding solutions or understanding their rights. I think that's really interesting, and there's maybe something for us to explore more deeply. So with that, this is not necessarily just a one-off webinar. This is now our second webinar in a series of webinars. And so in addition to this webinar series, we are also collecting stories that we will pull together in a compendium of colleagues within the SDG 16 plus space. So I'm going to drop a link in the chat to a Google form where you can submit your stories, but you'll also see on the screen right now a QR code that you can scan to access that form as well. And so we're planning a few more webinars before the end of this year, looking at webinars on the topics of fundraising, storytelling for donor audiences, also looking at sort of the intersection of arts, both kind of visual arts and other sort of narrative written forms of art in storytelling for our work and how that can support our communications, but also our advocacy. Also looking at connecting and linking in that conversation to that Voices of SDG 16 Plus campaign. Earlier in the meeting dropped a link in the chat to the Voices campaign, and this is something that TAP and AFP and CSPPS here on the call, along with several other organizations, hosts every year. So that's another sort of opportunity to engage in some storytelling work. If you head over to that link, and maybe we can send something after this call as well to let folks know about the opportunity to engage in that campaign this year during the HLPF. But all this to say, there will be more from us in terms of future webinars on storytelling skills and sort of unpacking and talking more about how to do storytelling, how to do it well, how to do it effectively, but also in parallel, really encourage folks to share the stories that they may already have with us so that we can pull together this compendium before the end of the year to support our collective advocacy and to really demonstrate the work that civil society are doing across the SDG 16 plus landscape, and to really articulate and demonstrate why investing in this kind of work is worthwhile, and further to really articulate to the points of all of our panelists today that civil society who are working on SDG 16 plus are really working at the intersections of SDGs already. So, you know, colleagues who are working on civic space or access to justice, peace building, conflict prevention, they're already working at the intersections of other SDGs like health, like gender, like climate, for example. And so we're really eager to use this compendium as a tool to promote this joint narrative and to really articulate the way in which our work is interlinked across the 2030 agenda for those of us working in this space. So With that, want to just thank everyone again today for joining us. Thanks to our colleagues, Nick Zarowski from AFP, Jayatsna Mohan from Forus, and Elise Granley from Civil Society Platform for Peacebuilding and Statebuilding as co-organizers in this initiative. And then a thanks again to Moses, Mathilde, and Leonie for our wonderful remarks and helping us facilitate this conversation today. So thanks everyone so much. And we'll hope to see you again at another storytelling webinar in the future. Have a great rest of your day.
Thank you so much. Bye-bye.
Thank you very much. Bye.